You mentioned the Indiana medical staff, and I guess that to some extent part of your job is to coordinate with all of these teams. And in this case, you've got 34 players here representing teams from all around the NBA. Is it part of your process to get in touch with medical staff, team doctors from all these teams who have players represented here? How do you go about that with such a large group?
So the bulk of the groundwork here is done by our two athletic trainers, Joe Sharp and Greg Farnham, who are on the cycle for this team, I believe over a 6-year cycle. And yesterday when all the players arrived, they all fill out medical questionnaires. In general, if a player has a really active issue, we have a lot of guys here this year who do, Kyrie Irving, Kevin Love, those guys, you'll always touch base with their medical staffs prior to them coming. But most of the guys, just typical sprained ankles, things that you and I would get if we were playing pickup basketball over the summer as well. But for the more serious injuries, you'll do what you suggested, is really kind of help figure out what their rehab plan is, and oftentimes those guys those teams will send representatives and trainers on a one-on-one basis to sort of continue the effort as well.
For players who don't come in with an existing injury, and I guess this would apply to athletes in lots of different sports, is there anything you can do as a doctor in terms of advice or protocol to help prevent injuries?
Well, yes, the succinct answer is obviously yes. Injuries are part of the game. I think the overwhelming number of them are non-operative, overuse things, sprains and strains, joints, ligaments, and such. Big push right now in many of the professional leagues on the prevention side. We're just learning that the volume of practice, getting the right amount of sleep, stretching, things that seem very vague and not particularly substantive, if put into a process, can really help. I mean, I really think the rest thing and the overuse thing, I mean, I played sports in high school and college. I just remember 2-a-days, 3-a-days, and you keep pushing people, obviously something's going to happen. I think we're understanding that the whole volume play, especially with regards to basketball. So largely over the summer, it's regenerative for these guys. So we take that into mind when we're coming up with their schedule here. Good
to see you once again. We saw Dr. Williams in Spain during the World Cup, and hopefully you're not pressed into action at any point over the next couple of days.
I would relish that, actually.
Dr. Riley Williams from the Hospital for Special Surgery in New York, working with USA Basketball.